Today, we're going to be talking about omega-3s. What are omega-3s and why should we be taking them?
Right. So it's good to be here. So omega-3 fatty acids are healthy fatty acids. These primarily make up the membranes of our cells and also are found in high amounts inside of our brain tissue. Why we should be taking them, and firstly, we can take them from many sources: fish, nuts, seeds, oils, etc. Have many different forms of omega-3s, but we should be taking them because there's a lot of historical data and also clinical data. The historical data looks at populations that consume larger amount of omega-3s. They looked at Okinawa. They even looked at Eskimos that live on marine blubber and high marine diets as compared to populations that are more like the American diet, the standard American diet. And what they found was a significantly lower cardiovascular disease rate, a mortality rate, and cancer rate. So that's the historical data. The more recent data is so compelling that we have pharmaceuticals. So we have Lavazza, and you have nutraceuticals, the more natural forms of omega-3s. But the reason why you would take them is because they're lowering inflammation in the body. And one of the ways in a lab we can see that is you see triglyceride lowering, you see hsCRP lowering, and you see people's lipids start to improve. So most important, lower inflammation. That's the mechanism. And the secondary benefit is, okay, how does that change tissues? Well, that lowering of inflammation changes the brain tissue, the heart tissue, and that's why you see people using it for heart health, eye health, brain health, and you name it.
So what about dosing, and specifically, generic fish oil versus EPA, DHA?
Right. So what you should always be looking for is a triglyceride form fish oil, right? So when you eat fish as it exists in the ocean or in fresh water, and when you press that fish or you fillet that fish and you eat it, that's in the triglyceride form fish oil, right? When it's synthetically manufactured, that becomes an ethyl ester. So the majority of the retail market is selling an inferior form ethyl ester. So when you're now circling back to a professional grade nutraceutical or a very, very good source fish oil, first confirm, is it triglyceride form? And if it is, that's a great start. That means that it absorbs about 70% better than the ethyl ester, and you're bioidentical to eating fish in nature. Then secondly, you're looking at about 2 to 4 grams of fish oil per day based on the American Heart Association, and new studies come out all the time. There's high dose fish oil studies up to 4 to 6 grams a day, aggressive anti-inflammatory benefits. But typically you're looking at 2 to 4 grams a day for lowering triglycerides, lowering hsCRP, which is inflammation, and lowering cardiac risk. Now, within that, though, remember, that is of EPA and DHA. So don't be confused when you go to Costco or Amazon, you buy a 1 gram fish oil that is standardized to 200 milligrams of EPA and 100 milligrams of DHA. That's 300 milligrams. You would have to take 12, 13, 15 capsules. Make sure you're using 2 to 4 grams of EPA, DHA combined per day. So that's kind of the devil in the details. Always read the nutrition label.
Absolutely. So tell me about freshness. And we've done this little trial in our pharmacy. We bought some fish oil from Walmart, and right. we bit it open, and our pharmacist almost threw up. Whereas Orthomega, it's fresh, and so it's not rancid. Tell us about that.
So this is kind of the crux of the whole fish and oil industry. This is why someone may turn on their cell phone and see Google ads and research reports and mainstream media saying your fish oil doesn't work, right? So let's start there. So there's a lot of controversy around fish oil. And the reason being is because it's around the manufacturing of fish oil. It's not around the actual fish. We know that eating fish is healthy as long as it's clean and pure and wild. We know that omega-3 fatty acids are healthy. So what's the disconnect? Why is there an article saying fish oil doesn't work when consuming this we know is healthy? And the answer is, what happens during the manufacturing process to the oil? It's the same thing that happens to many different fats in American manufacturing, which is you start to see hydrogenation of these oils and oxidation of these oils. Oils are some of the hardest things in the world to manufacture because they're alive and they're very sensitive to air and oxidation. So when you use a professional grade fish oil, one of the biggest challenges is through molecular distillation, essentially a purifying process, is not having it oxidize. Oxidized fish oil and fish oil that's not pure is what tastes like that nasty, fishy, rancid taste. When you have a pure fish oil and a fish oil that's been purified to remove any type of fish protein, you should be able to bite into it, and it should taste like olive oil. It should taste like a clean oil. And then also when you take a professional grade fish oil like Orthomega, we're adding antioxidants into it and rosemary and mixed tocopherols to protect the oils from oxidizing. So I actually do agree. Fish oil actually can be very bad for you. Cheap fish oil can oxidize and create more inflammation in your body. The last thing you need is more bad fat. What we need is good fat. And so we want to get that through our diets, or a very pure professional grade fish oil that stays stabilized and pure until expiration. But yeah, I chew on them daily. I have many clinicians who chew on them because people complain about the size of a fish oil soft gel. So the easy solution is just chew on it. Then you don't have to swallow it.
And what is the dose in Orthomega for EPA, DHA?
So there's a 1 gram dose of omega-3s as standardized to 430 on EPA and 390 on DHA. So you're at about 820 milligrams of EPA DHA. And then there's an additional 50 milligrams of DPA, which is an exciting new topic, but we'll call it the reservoir in your cell. Yeah, DPA is a very important reservoir for omega-3s.
Right. DPA is pretty unique to Orthomega. So thank you, Trevor, for that. It's been very educational on omega-3s today. Thank you so much.
Thank you, Shawn.